What does it mean to be diagnosed with generalized anxiety disorder? Before we answer that question, it is important to keep in mind that to assess the severity of the symptoms, a clinician should be involved in the diagnosis. Now, let's talk about generalized anxiety disorder, otherwise known as GAD. The excessive anxiety or excessive worry causes significant distress or impairment in a person's life most days for at least 6 months. Excessive anxiety can occur anywhere and hinder performance in everyday activities. GAD is not just everyday anxiety that most of us experience. Further, the anxiety is not due to effects of substance use or a medical condition. The anxiety is not a product of an external event in a person's life. For example, if you're in the woods camping and you hear a bear and then fear arises, this is a rational fear that everyone should have. However, GAD is more of an irrational fear, an overreaction to a real fear or a fear based on an unlikely event. For example, a person with GAD could worry that a meteorite will land on their house. While this is not entirely impossible, a person without GAD generally spends little or no time worrying about these unlikely events. To be diagnosed with generalized anxiety disorder as an adult, the anxiety and worry are associated with 3 or more of the following 6 symptoms. However, a child only has to have 1 symptom. Here are the symptoms: restlessness or feeling keyed up or on edge, being easily fatigued, difficulty concentrating or mind going blank, irritability, muscle tension, sleep disturbance such as difficulty falling asleep or staying asleep, restlessness or unsatisfying sleep. Additionally, the anxiety symptoms are not better explained by another type of anxiety disorder. For example, anxiety caused by panic attacks, social anxiety, obsessive compulsive disorder, separation anxiety disorder, or post-traumatic stress disorder. As you can see, there are many other disorders other than GAD. In other words, a person could have all 6 symptoms of anxiety and not have generalized anxiety disorder. This is where a trained clinician can help. For example, a person could have all 6 symptoms but only display them during social situations. This would likely not be generalized anxiety disorder. As you can see, diagnosing generalized anxiety disorder is fairly straightforward. However, this video is not intended to diagnose yourself or anyone else, but to understand how generalized anxiety disorder is diagnosed.